Hi, this is Maya Moore, coming to you on another short video regarding MFT's approach to psychopharmacology, as well as ways that they could take a stance on drug therapy and the limitations and benefits behind it. So we're going to start with that first question regarding the key principles that the MFT should actually consider as a guide for their approach to psychopharmacology with their clients. One of the more important things to keep in mind as an MFT would be that drug therapy can be helpful, however, it will not cure anything. So it's very important to have the client understand that there are going to be some drugs in certain situations that definitely could help or make for their situation to have a better outcome, through some drug therapy. However, they should not lead with pharmacology, as well as again, having that understanding that it's not a cure, it's not a way to fix the problem, but more so band-aid it and help in the guidance of that client having a better outcome. The other side of that is making sure that the client is even they want to be on medication. Not everybody likes medication or even understands the side effects and the different things that your body goes through when you agree to take a substance to help with one problem. In some cases it can cause issues in another area. So it shouldn't be something that the client should feel like it's being forced upon them or like they have to do in order to better their situation or to better their outcome. I think the more important thing is also keeping it as more of a last resort option. There's so much more information out there as far as the research behind different situations and the things that clients are going through with their various situations. We want to make sure again that medication isn't the leading factor in how that person is going to experience on that outcome, more of a situation that they may need down the line. How can MFTs be more proactive in their stance and to the respects of the limitations and the benefits regarding drug therapy? This one is interesting because one way to really take a proactive stance is to do your research and know the information about the various causes and effects, whether it be drug medication, some type of behavioral therapy. The MFT wants to be knowledgeable on the different angles that can help the client. I think speaking with confidence and understanding about the situation for the client is going to help them feel more confident in getting to a resolution and bettering their situation. And according to Sparks, a 2002 article, 70% of the antidepressants that's actually prescribed are prescribed to women. The MFT wants to make sure to not make a connection to society's drawn out way of thinking. We want to make sure that if medication is being prescribed for different situations, that it's for the right reason and something that's going to help the client and not put them in a situation where they either are not going to get any better or definitely through a different type of therapy other than drug therapy, they could have actually improved their situation. I think also a big part of staying proactive, especially on the I guess the benefit side of it rather than a limitation is keeping the client involved. It kind of goes back to what I was saying about the clients not always want to be on medication, but the MLT wants to make this seem like a partnership. Like, it's really up to that client how they are going to improve their situation, but they want to give them options that make them feel more involved, like they are a part of making this change. Sometimes, again, putting that medication in there just kind of mask everything over. It doesn't really help solve anything. It just helps them get through temporarily. And it's really important that we're setting the right expectations and helping that client feel like they are also part of their solution to a better life. Whereas medication, again, it's going to be helpful in some situations, but it definitely, again, shouldn't be the leading option for helping the clients. Overall, there's always going to be those limitations and those things that are going to get in the way when you're talking about the different types of therapies and different situations, especially when you're going with the schizophrenia and bipolar. I mean, you're going to have situations where medication is important and may be necessary. However, we also want to make sure to educate the client on how they can definitely improve their life and do what they need to do without or with little medication involved in order to get to that point. Well, thank you. That's my answers to those questions.